KCTV Lone Rashapi Daka Frank Motors Kajaka Dekali Gabatamai Junka Tata Motors Halatgor Ni Shillong Rinkat Baganet Foodish Ordar Mapi Ninwan Ramani Hakir Dobying Jompi
Department of Pediatric Cardiology and Pediatric Cardiac Surgery jangka Apollo Hospital Children's Hospital Chennai but Apollo Hospitals Guwahati haga sngithot dieng ka arpuar tri yong arajar arpuar da ka jing tri lang bat ka office u Director of Health Services ka Sarkar Meghalaya kala pentip sigi pai ba nong snong ka jela Meghalaya bahkan penlong ya ka Jingsumar ya ki khlung ki badang sukha hadu ki khana ki balakan jo ekarta ka bakhan riusnam ki badan ya ka jingpang Klongsnam Dr. Neville Solomon upapai ka Pediatric Cardiac Surgery jangka Apollo Hospital ha ka jing kran bigila pathai ko bor ulayat hu ya ka Jingsumar nak benta ki bapang mulumala on sale ha Guwahati kat bai ki bla khamshutom jur on sa Sumar ha Chennai ha ka baki kimi ki pa kim don kam satya ban siu pisa AA wat shinayaru ha ka jing penlong ya ka screening camp ha Ganesh Das Maternal and Child Health Hospital Shillong ki doktor ka Apollo Hospital ki lalam bana pedang kisan pongot ki khana ki lawan syakni ka jing a Jingsumar khat san ngot na pedang jongki lalam bagi dan ka jing pang Klongsnam nakini laingut ki bla supang malumala on sa Sumar ha Apollo Hospital ka badana Guwahati kat bai ki khat arngut ki weipat ki ba khamjur ka jing shutom on sa Jingsumar ha Chennai.
We have taken this step to bring pediatric cardiology services to this part of the country. The services of pediatric cardiology are provided by Dr. C.S. Kumar, who would be leading this initiative in Meghalaya, wherein we would be collaborating with the Department of Health Services and organizing a screening camp. Today was the first screening camp which we organized, and any patient, any child who requires a surgery or a procedure would be taken to either Guwahati or Chennai, depending on the severity and the criticality which doctor would discuss in detail, to either of these two hospitals, and the patients would be financially supported through our foundations, through other philanthropic initiatives, and through the part of the organizational CSR.
The Indian population, around 2.5 lakh children are born every year with heart disease. Unfortunately, these children, only a handful reach the hospital for surgery, and most of them they die or they become inoperable. It means they go stage, they are in end-stage heart disease, and they don't have a proper healthy life. So at Apollo Children's Hospital Chennai, we started the department around 14 years ago, and we've been able to cater to the Tamil Nadu population. And a lot of patients from Shillong and Guwahati Northeast should travel to Chennai for having the surgery done. But having said that, traveling to healthcare for long distances is not a viable option for most of us, most of the low socio-economic people. So we actually, as Apollo groups, we have got the advantage of having an Apollo hospital in Guwahati, which has got two hospitals now. So we want to join hands with Apollo Guwahati in giving a comprehensive pediatric cardiac facilities to the people in Shillong, and through the government initiative. The government, through the National Health Mission and also through the Director of Health Services, has to join hands with us. And today we have done a camp in Ganesh Das Hospital, where we have screened around 50 children. I found out around 17 of them would require surgery. So here, if you see, the congenital heart disease can be categorized into two categories, where they have simple and major and complex surgeries and interventions. So what I mean interventions is most of the heart conditions can be cured without surgery, without opening the chest. They can go to the groin and put a plug or open the valve without surgery. These children can lead a normal life after that, no need for any medications at all for lifelong. For that, we're going to do the simple interventions that can be done by us in Guwahati Apollo, and establish Guwahati Apollo slowly that they can able to do it in future in complex surgery. Having said that, we also would like to involve the government doctors in Meghalaya to train them in particularly in interventions and also screening children. So long run, Meghalaya government hospitals will be equipped to handle this complex heart conditions. patients have got complex major heart condition who require major intervention. Now they are being asked to come to Chennai. We will arrange, the government has said they will arrange free transport for these children to come to Chennai. So we will receive them in the airport or in the train station, and we'll give them free food and stay in Apollo Children's Hospital, and they will be sent back to Shillong safely after the procedure. So those things have been we have an MOU with the government which you want to sign up, so that the whole holistic approach of having the whole congenital heart disease covered by us. So we plan to come to the Shillong every 2 months, maybe earlier every month also, to screen children. So we won't be only in Shillong alone, we'll be visiting other centers in Meghalaya. So the government DHC centers and also the RBSK will pool people who have got suspected the heart disease. Once they have got a group of children, then they are calling us. Then we come and do a free camp with our echo machine, which we bring from Guwahati or Chennai, and then we do a screening camp, identify the patient who required surgeries or interventions, we categorize them and do them accordingly. Some children may not require anything at all. Some medications enough, so those we guide them accordingly. The government schemes, they don't need to pay a penny. The government takes care of it. If in case they can't, they can afford, they also can get in touch with our people, our marketing people, and then they can come to Chennai or Guwahati depending on the condition. But some people, the money is not what they require. I just want to mention again, the children's life is very important. Even though they don't come under the socio-economic status, but they don't have that enough money, then we do have charity to support the people who are coming on the yellow card, ration card system, where they don't have the government health insurance scheme. We do cover them with our foundation. We do run a foundation called Save a Child's Heart Initiative from Apollo. I run a foundation, Little Hearts Trust, for my people, and also other NGOs have been attached to Guwahati Apollo. So that children's hospital also, where we can support these children also. So what we really want the message to reach the public is, they should not think money is not a big issue. They should need to get initiatives that children can be cured, and they should approach the local government hospitals here, asking for the date when we are coming for a camp. Then we can do a camp and then send the take the patient to Guwahati or Chennai, depending on the conditions. As I told you, one of the commonest birth defects that happens in children is heart disease. It just happens by chance only. There is no genetic involvement behind it. But what are the causes it can happen is, if you are getting married within relatives, the genes can come and can represent ourselves. It can also happen when the mother is not having uncontrolled diabetes during pregnancy. When alcoholism is also a cause for babies to have a heart disease. So moreover, one more thing is, what we have done in Tamil Nadu is we are screening this 18 weeks gestation, 20 weeks gestation ladies, when they are having a baby inside the womb. We can do echo for the fetus and find out whether they have a heart problem or not. That's something we will develop in the future, which is called fetal echo program, where we can diagnose this earlier. Since we don't have the facility available in Meghalaya, in all the government sectors, I think that's the reason we are having more children with heart disease. Once we start the program running now, we have to clear the backlog. Already patients are born with heart disease. Develop a program where we can prevent the heart disease children by having a fetal echo program, which will start up in the government sector soon.
Accessibility to
health services.
To help to pediatric cardiology services.
So the media should help us. All children, people, parents, or they who are reading the paper should know that there is access to the government system only, to Apollo hospitals. They can get surgery or intervention free of cost. That should be highlighted so that the patients can contact the local government hospitals here, asking for the Apollo group when they are coming for camps, so they can be properly screened and taken care of.